My name is Jaquavious HCA, and this is my healthcare management business project. I'm a junior healthcare administration major with a minor of human resources. The organization I choose to talk about is Grady Memorial Hospital in Atlanta, Georgia. Grady provides some outstanding care in a diverse atmosphere, very ethical in a responsible manner. Grady provides its health mainly to Fulton County, Clayton County, Henry County, Cobb County, and majority of the metro Atlanta area. Uh, Grady is a nonprofit corporation and is created and charged with administrating the health system. Um, some of Grady's business model, Grady has a $242 million strategy plan to lift the hospital administrating policy. The system wants to spend at least $50 million to improve technology, a move to electronic health records, and more than $100 million to upgrade medical equipment. The reason why I chose the Grady Memorial Hospital is kind of a personal kind of feeling for me. I'm an Atlanta native and I'm from the metro Atlanta area. So the only hospital that I've ever really known is Grady Hospital. Unfortunately, I wasn't born at Grady, but prior to me being born, all of my family was born there. So it's kind of a personal feeling to me. I've always passed by Grady. I drive past it every time I go home, and I've always heard about the Sanjay Guptas there and all of the big trauma facilities there. So Grady is something that's kind of big to me. So it was kind of an easy decision to talk about because I've always inspired to work at Grady because I've seen it my whole life. So the things I like about this organization is that not only does it have is Grady, it has 6 other major facilities, and it's one of the biggest facilities where people, as myself, that's in college, practice their profession, and it's also home to one of the biggest trauma facilities in the nation, not only just the state of Georgia. So I chose Grady because one day I inspired to work there, and hopefully I can be a healthcare administrator there. As long as I can remember, since I was born in 1995, Grady has been around. So a little history about Grady Memorial Hospital. Grady is home of one of the largest healthcare systems in the entire world. Grady first opened back in June 2nd, 1892 to serve the metro Atlanta area. Grady was created by an Atlanta journalist, editor, and newspaper owner by the name of Henry Grady. Well, he wasn't mainly the creator, but the hospital was named after him. But Grady envisioned and promoted a new South. I mean, back in 1892, it was a time where the South was still segregated. So for Grady, the hospital was a creation that served as a facility for all colors. A year after his death in 1899, the city passed a resolution to build a hospital in his honor. The hospital was intended to provide care for the low-income families in the metro Atlanta, Georgia. Back when Grady first opened, it only started with 18 employees and 100 beds. And unfortunately, back then, each room wasn't for everyone. So with the 100 beds, it was roughly 50 for black and 50 for whites. The hospital also featured one operating room with an amphitheater for students and staff. Some of the services that Grady offers is not just the emergency room. There are many and several different facilities throughout the hospital. For one, Grady has a nationally acclaimed burn unit. It also has a diabetes center, intensive care unit, and is widely recognized for its low mortality and a very high-risk patient population. It also has a 24-hour comprehensive sickle cell unit. It is the home of Georgia's Cancer Center for Excellence. The State Poison Center is also home at Grady. And Grady has, also, like I said, a EMS service. The largest publicly funded infectious disease program in the United States in the eastern region is housed at Grady as well. Grady is also internationally recognized a teaching hospital, so it's staffed exclusively by physicians from Emory University School of Medicine and Morehouse School of Medicine. 25% of all physicians that work in the state of Georgia receive some type of training or education or some type of practice at Grady. Grady is just a home of health in the state of Georgia. A big makeup of Grady is not just the patients. The most important thing when it comes to this facility that keeps it running is the staff. The total staff count as we speak of today at Grady is 5,742 employees. There are 1,008 physicians on Grady medical staff. 95 of the physicians are board certified, so that's a big number. There are 485 volunteers at Grady, and there was a collection of over 27,129 volunteer hours collected at Grady. Some of the aspects that Grady is known for, it's known for its rapid response team. The rapid response team acts as a support system to the nurses and physicians when they have a concern about a patient's condition. The goal of the rapid response team is to save lives through early interventions. Also, they have a fall prevention program. That program helps identify all adult patients at risk of falling. Patients are assessed upon admission and daily for a patient's length of stay at the hospital. They also have many other programs, as like the You Speak, We Listen program. Is where patients are active members of their healthcare team. They develop a program designed to encourage patients and their families to speak up concerning all aspects of their healthcare experience at Grady. They also have a hand hygiene campaign with the World Health Organization hand hygiene guidelines. Grady expects all healthcare providers, including physicians, nurses, and staff, to clean their hands before and after every patient contact. They encourage patient and family involvement, ensuring hygiene compliance. They also have a pressure ulcer prevention. The goal is to eliminate pressure ulcers by preventing skin breakdown. Grady also has a skin safety program to evaluate and treat programs in order to reduce the incidence of pressure ulcers. The topic that really correlates with this organization of Grady Memorial Hospital will be public health. In Chapter 5, the book discusses public health, and it refers to public health as the science of art of preventing disease, prolonging life, and promoting physical health and efficiency through organized community efforts for the sanitation of the environment and control of community infections. One of the main goals of Grady Memorial is the health of the public. That's usually how all hospitals work. The main important goal is to ensure the safety and the health of the population. The reason why I chose this article is because it directly correlates with my organization. The title of this article was called "Grady Other Area Hospitals Lag on Quality Care," new report says. The reason why this article was so personal for my organization because it states that my organization was ranked as 1 star out of 5 stars, the lowest being 0 stars. So this was pretty alarming for me, being that the organization Grady was ranked so poorly. And if you read the article says that Grady is not really providing quality care, and the #1 focus here is our patients. So if to others our care is not up to par, then we have a problem, because this could lead to a lot of more severe issues down the road. This article talks about the current status of the hospitals, and that's a direct correlation with the chapter 6 of our book that talks about the current status of hospitals, of how although they evolved from where they were when they first started, that there is plenty of work done left to be done. Although hospitals have came a long way, they still have room to improve, and that shows fact with Grady that, although Grady is one of the largest hospitals in the United States, that it could rank so poorly that, there's still a lot of work to be done within the healthcare system. The book talks about that the hospitals are working with the Joint Commission Center for Transforming the Healthcare World. The main points in this article was basically that a lot of the surrounding areas, hospitals in the Atlanta area, have very bad ratings. Atlanta ratings reflected that they were below national average on safety of care, readmissions, patient experience, and timeliness of care. Piedmont Hospital was also below the national average of mortality, effectiveness of care, readmissions, patient experience, and the timeliness of care as well. The biggest potential problem I see with this article facing my organization is that the ricochet effect that it can have. Like potential patients, once they see that hospitals will rank poorly, they would usually tend to shy away from it. So, if there was a possibility of patients seeking to be seen by another facility because Grady ranks so poorly, then I believe they would start doing that. And then if one person does it, then another person doesn't, and it just ricochets to where, unfortunately, that patients would be very few. Although this could be a potential problem, I really don't see it expanding into a really problem, because in the state of an emergency, not too many people are going to seek to go elsewhere to receive health care. If it's a life or death situation, you usually not going to pass a hospital to get to another hospital. That's just crazy. So although this could become a problem in the moment, you're not really going to pass Grady to get to another hospital, because in a life or death situation, your main focus is just getting to a hospital. So I don't really see this become a potential problem. It could escalate into a small problem, but the chances of it growing high and patients avoiding Grady just because of a ranking that may or may not accurately display the care that Grady provides. So I really don't see this becoming a really big problem due to the state of emergency in the time. The way I think this will affect future business decisions, I think really is only up from here, because the scale is based off 5 stars, and with Grady receiving a 1 star, I mean, you really can't get no worse than that. I mean, you could possibly receive 0 stars, but you really only see room for improvement. So I would say all business decisions now, every little thing matters, because Grady is being graded so harshly. So I would think that the room for detail, attention for detail, would be extreme, because you don't want to be graded like this before. So I say that Grady can only go up from here. So even though this ranking is kind of bad, I see it as kind of a good thing, because there's only room for improvement. How does this problem affect my competitors? This article, although I focus on Grady, this article not only pertained to Grady. This article pertained to other hospitals in the Metro Atlanta area too. There were a number of hospitals that were rated poorly. No hospital in the Atlanta area received the 5-star rating for quality of care, and several major medical centers received only 1 star. Emory University on Clifton Road received 4 stars. That's been the best among all the area hospitals. And Piedmont received 1 star as well. Even the VA Medical Center was not rated. So, and other area hospital receives 2 or 3 stars. So this not only affects Grady, but this also affects all the surrounding hospitals in the Atlanta area. So although this is it could be a ricochet effect, only a few hospitals were graded well. So that's not good in a sense, but in a sense that maybe there were some areas on the grading scale that you're not to think too much of it. Some of the questions I would have for my organization is what can we do as an organization to improve our average on safety care, and what steps could we take to improve our effectiveness of care, And how do we improve the patient's view of our facility and the care that we provide here? What can we do as an organization to improve the timeliness of care? What procedures could we put in place to differentiate ourselves from our competitors? Rules and regulations that we already have in place that we can keep but improve upon to where they get better. And I would also ask, what can we improve about our organization structure that deems us successful? So what can we do as a whole to make our unit strive as to the point where on the next rankings we can be rated 5 stars? So that would be some of the questions that I have for my organization.